The CDC has now confirmed 3 cases of MERS in the U.S. since the first case was reported earlier this month.
News 18's Elizabeth Rentschler joins us now with more on how hospital officials are preparing should the virus make its way here to Lafayette. Elizabeth.
Jeff, Gina, the CDC has been warning hospitals across the U.S. about Middle East respiratory syndrome for quite some time now. With the first case being reported right here in Indiana, local hospitals say they're prepared should the virus head to Greater Lafayette.
Hospital officials have known about the potentially deadly MERS virus for more than a year, and in that time, they've been preparing.
We feel like we're prepared.
Laura Aschenberg is the infection control manager at Franciscan St. Elizabeth East. She says Tippecanoe County and its hospitals participate in emergency preparedness training multiple times a year. She says much of that training is centered around infectious diseases and what to do should it make its way inside a hospital.
There's masks at our entrances, so we would like for them to put on a mask, and then depending on what the doctor is seeing when they get here, they would order tests, and then that patient would be put in isolation.
Down the road at IU Health Arnett, the same protocols are in place. Thomas Meyer, an infectious disease physician, says they've been going through the training and educating their doctors on the disease for quite some time.
We're notifying doctors of what to look out for, when to suspect it, how to get testing done if you happen to run into a person that could potentially have MERS. All the footwork's been set in place long before the first case came to Indiana.
Even though the virus carries a mortality rate of 30%, Meyer says he doesn't want residents to fear. Because the virus is spread through close contact, he doesn't believe the virus will become anything widespread.
Similar to the SARS epidemic from a few years earlier in China and Southeast Asia, that never set root in the United States.
Even though Thomas Meyer doesn't think the virus will become widespread, there are still things you can do to prevent it. He says residents should treat it like the flu, cover your coughs and sneezes, and always wash your hands. Elizabeth Rentschler, News